Okay, I do have just a few slides to talk about a few topics that are usually of interest to folks and provide some updates. And then hopefully we'll have plenty of time for Q&A as we get towards the end of the hour here. So let me just jump into that. I'm going to provide a little bit of a COVID update, some budget and search updates as well. We'll talk about some other acknowledgements, professional achievement recipients, our outstanding students and faculty. We've had a few transitions. I know we always welcome new people at our fall and spring opening assemblies, and we thought, well, we would acknowledge folks that are either retiring or resigning at the end of spring semester. And then we do have a few results that I'll share, and we'll post the full report related to the employee engagement survey that was done by HR earlier this year. And then, as I said, we'll have time for some Q&A. So I think folks are pretty well tuned in to the current health status of our campus community, as well as the wider community and state. Obviously, COVID rates are declining as we're seeing vaccine rollout. There is a bit of, I guess, stalling of the vaccine rollout, not only in Idaho, but nationwide. So I would encourage those of you who've not yet been vaccinated to do so, and also to encourage family members and friends about the importance of vaccination to really sort of squash this pandemic and allow us to get back towards normal. We are still doing some COVID testing and screening on campus. Screening will be available on the IF, Meridian, and Pocatello campuses throughout the summer, particularly to support travel for unvaccinated individuals. Other folks that have concerns about exposures and that kind of thing can also be screened. Symptomatic individuals can also seek out some testing on campus. And then we will likely be continuing some screening of high-risk populations, particularly in the dorms over the summer and perhaps even into the fall. Vaccinations, those of you on the Meridian campus, I think, have been aware of the great vaccine rollout that occurred on that campus. We have a similar program going on this campus, and I want to acknowledge Chris Owens and Brady Bauer from Bengal Pharmacy for helping to organize and work with Southeast Idaho Public Health on the vaccine program that is up and running at the sports medicine building next to Holt Arena. You can make appointments for that vaccination through the SIP website, and our own Bengal Pharmacy has vaccines available as well, and you can make appointments through them. Both SIF and Bengal Pharmacy will be collaborating on vaccination during new student orientation as the students come on campus beginning this next weekend and continuing through the summer to encourage vaccination of that group. Oops, jumped ahead here. Many of you have already heard about the Roaring Back return to work plan. At this point, if we continue the same kind of trends we're seeing with decreased disease activity, we are anticipating a transition with the fiscal year towards a return to campus and a return to new normal. That being said, we really don't have a crystal ball. We don't know exactly what's going to occur. We will likely still have face coverings in place, although that may change as CDC guidance changes and as we increase the vaccination rate in our campus community. Generally speaking, though, 12-month employees should be thinking about returning to campus and within their academic or administrative unit with the transition to the new fiscal year, which is June 28th this year, right around July 1st, with the goal that all areas be fully operational by August 2nd. Those faculty that are on a less than 12-month appointment can return to work as scheduled. and telecommuting exceptions for health-related conditions and otherwise are still allowed. HR has encouraged us to talk to everyone about the telecommuting policy, which is 3120. Just to talk a little bit about budget, there's still a lot of uncertainty around our budget. We did budget presentations at Leadership Council several weeks ago, but because of what's happened at the legislature this year, and I can provide a little bit of data and information and background on what's happened at the legislature, we still don't know where we're going to be sitting in terms of our appropriated budget from the state. Now, our initial forecast was to have a functional deficit, an operating deficit of about 5.3 million for this next year. That was based on enrollment trends and projections and the historical deficit that we've been dealing with. We also know that there are several variables that can affect that significantly, state funding obviously being one of those. The Joint Finance and Appropriations Committee has now sent 2 budgets to the Senate and the House. The first one being rejected. They went back, reworked the budget. They included reductions in the higher education budget, primarily related to, if you will, punishing the universities for diversity, social justice, and critical race theory related allegations that that some legislators had been levying against higher education. That budget that was just approved by JFAC included a $2.5 million reduction from where we started with the governor's budget. And that did pass JFAC and was sent to the Senate and the House for full ratification. And that hasn't happened yet. The amount of reduction in funding targeted, I guess, at ISU is about $500,000. So that will serve to potentially increase the deficit that the university is going to be dealing with. The university is planning on using reserves. It is also planning on growing enrollment, and our enrollment is actually ahead of where we were in the spring of 2019. Obviously, 2020 was severely impacted with recruitment and enrollment. So that's a good thing. And we will see as we progress through the summer, the number of registrations that occur, because new student orientation and registration is being done quite differently this year. So we'll see if that trend holds in terms of us being up on enrollment. If it does, then obviously that will affect our deficit in a very positive and meaningful way. There are also some funds that will be utilized, federal funds, once the legislature authorizes the use of some of those funds, that will potentially impact our budget deficit and allow for some relief related to COVID. And where we have made several proposals for strategic investment, particularly within the division. Those have not been voted on yet by Admin Council. So those decisions have not yet been made. They were presented and in detail evaluated by Leadership Council a few weeks ago, but the Strategic Investments Admin Council is waiting on kind of all of these other variables to shake out before those are voted on. And so you can see in terms of next steps, those Leadership Council budget recommendations were forward to Admin Council. We've got to go through the legislative process. We also haven't had SBOE approval of tuition and fees yet, partly waiting on and seeing what happened with the legislative budget. Usually that's happened by now, and it hasn't. And then the CEC, or Change in Employee Compensation Plan, will need to be approved. And I have a slide coming up in just a minute about what will happen with our raises. That's the CEC plan. And then finally, once all of those pieces are together, Admin Council will look at all of those elements and eventually approve a budget for the university. So what's happening with CEC, or change in employee compensations? These are the raises that we're talking about. On March 19th, the state issued guidance to distribute up to a 4% CEC at state agencies. The rationale for this was 2% that we didn't get for this budget year, 2021, and another 2% for FY 2022. The problem that occurs at the university level is that this raise only comes with appropriated dollars, and that's deemed the fund shift. There are many positions at the university and within the division that aren't paid for by appropriated dollars, so we need to find additional funds to support these raises. Because we likely won't be able to find a full 4% for everyone, the current plan, and again, this is not final, the current plan is that ISU would have funding for about a 2.5% increase in employee compensation. And this is partly due to the fact that our budgets have been cut. We are not going to see an increase on most of our student fees, although professional fees we will, because we've tried to factor that into our budgeting. And we're operating in a deficit situation. So with all of those constraints, what ends up happening when these calculations are made is that the university typically has to take the state money and then apply it across everyone, including those that are not funded under state monies. And the net result is a decrease in the amount of raise that everybody for. The state also requires that this be done based upon merit. And so HR will be working on that plan. Again, this is still up in the air a bit because we don't have a final budget for higher education. I'm absolutely, I would like to answer questions about raises and about budget. I'm not seeing any in the chat right now. If people want to fire some of those to Leanne, that's perfectly fine. Or I can pause for a minute and see if anybody has any question right now. If not, I'll move on in the slide deck. Does anybody have any questions?
We did have some COVID-related questions, Rex. I don't know if you want to address those at the end of your presentation, or and then we do have one.
Let's come back to those if that's okay. I was pausing, I guess, for the CEC and budget because that's just it's a little convoluted. Anything on budget, Leanne?
Not directly.
Oh, I do see a couple in the chat. When will we know about professional fee approval? Probably at the June board meeting, Ellen. This is, again, the state board put off making those approvals, partly because they wanted to see what was happening with the rest of the budgeting process. And it's taken so long for this legislature. I think people have heard it's one of the longest in history to come up with a budget. The state board was just a little reluctant to approve things when we didn't know what the rest of the higher ed budget was going to look like. Normally, professional fees and tuition increases are approved in the April board meeting. And because the legislature, it still isn't done here in the beginning of May, that was pushed out so that we could, take a look at the entire financial situation. So I don't expect that the legislature will stay in session for too much longer, although there were new tax bills and that kind of thing presented. So who knows how long it's going to last, but I'm anticipating June is for that professional fee approval. And then Eric asked, is it safe to say that the most anybody would expect is a 2.5% raise? I think that's safe to say at this point, pending these calculations and a CEC plan for that HR is going to have to put forth and then have approved by the state HR department. But I think that's safe to say at this point, Eric.
Rex, I have another question related to that 2.5%. Is the 2.5% across the board for everyone, or an average based on performance ratings?
The 2.5% might be a maximum based upon performance ratings. It's possible, though, that some could get a little more if the spread of compensation is changed based upon the performance ratings. The state ties the CEC to merit. And so we take an average 2.5% pool and distribute it across the group. And again, we haven't seen the final plan, but that's how it's typically done. It's possible that some could get a little more, some could get a little less, but it's not likely to be too wide of a spread around that 2.5% mark. I don't know, Brian Hickenlooper or Joe, do you want to just talk about how that's been done in the past? I don't mean to put you on the spot, but.
There's another question also, if one of you can answer that's related. Who is involved in the decision-making process about the blanket raise amounts?
So HR comes up with a process and presents that to admin council. That's the process. It's fairly standardized from year to year, but it's based upon guidance we get from the state as to how to distribute those funds. So that's who's involved in that. And of course, it's also tied to employee performance and their evaluations. Brian, did you want to say anything about how that's distributed, at least in past years?
Just in past years, you're exactly right. You could have some people above the 2.5%. You could have people below. It's based on the merit. Because the percentage is so low, my guess is, like you say, it'll be a very collapsed spread. You won't have a 5%, somebody getting a 5 or 6%, and somebody getting a 1%. But the average does have to come out to the 2.5%. Because they have to submit it to the state, has to get approved by Division of Human Resources with that plan.
Thanks, Brian.
There's a couple more
any others,
questions.
Leanne?
Yeah. So there was a point made about technical records specialists 1 and 2 who were left out of a recent pay adjustment. And there's a question about if that will be addressed.
So in the governor's budget, this is my understanding of this. And again, Brian, Joe, jump in here if I get this wrong. In the governor's budget that was set forth, there were certain employee categories that were felt to need basically a bump in the pay scale at the state level. Not all classified positions were included in this. And so, yes, several classified position categories were left out of that bump. So, this raise will apply to everybody, but it was separate from the governor's proposal to bump certain classified positions within the state system to, at least theoretically, based on their decision-making. This isn't ISU decision-making, it's done at the state level. To make these positions more competitive in terms of the salaries that are being paid. And not every classified position was included. And it doesn't seem fair, I understand, but that came directly from a governor's directive, as I understand it. Joe or Brian, anything to add?
So, I can talk about it a little bit. The legislature took 20 of the classified positions, and only 20 of them, that across the state that were identified as most in need of equity adjustments. This increase that was given to some of the to those 20 classifications was not based on merit. It was an equity adjustment. And so it's not the same as a CEC, although it is a CEC. It was a change in employee compensation, but it wasn't under the same rules of being merit-based. It was an equity adjustment decided by what the legislature approved. And they identified the pools or the 20 classifications that were included in that adjustment.
The state has been working. Thank you, Joe. The state has been working to improve the salaries of many of the classified positions over the years, including, the starting salary, as well as making these kind of mid-course adjustments, as Joe just outlined. Clearly the state has fallen behind the private sector in some of these positions, and that's their attempt to try to address that. And we recognize that it still may not be adequate, right? Leanne, I'm going to move on, and I can circle back to a few more questions at the end, if that's okay.
Okay, there are a couple more on this topic. So.
Okay, I'll try to get through these things quickly, and then we'll come back to them. So I wanted to provide you with a quick update on a couple of our administrative level searches. The Meridian Executive Director position is currently being searched. That search committee is active. Diane Ogella from CSD is chairing that committee. That committee is formed of a variety of individuals. I think there's 14 people on that committee. We have clinical and tenure track faculty. We have staff representation. We have a lot of Meridian representation on that committee. A few folks from Pocatello. The president also had some say in the composition of this committee, and I think rightfully so, suggested a couple of folks from outside the division and even outside the university. We have a woman from St. Al's that works in their workforce development office, for example. We have retired university relations and legislative liaison. Kent Coons is serving on the committee. Our Dean of Students and our Dean of the College of Business are also on there. It's a large group, and again, tried to be very, very representative to support not only Meridian, but the division and the directions that the president had outlined he wanted to go with this search. So that's moving forward. And the position, if it's not posted now, will be posted very, very soon, and the committee will begin evaluating candidates. Teresa Connor, who is the incoming dean of the College of Health, has had to again postpone her start date. Unfortunately, Dr. Connor, and she gave me permission to disclose this information, developed a blood clot. This was not long after receiving her COVID vaccination, and she is concerned about the at least the temporal association between the vaccine and her blood clot, and is recuperating. It was a lower leg blood clot, so it wasn't one of the more severe, very, very life-threatening blood clots that have occurred in a very, very small number of people associated with the Johnson & Johnson vaccination, which is in fact the one that Dean Connor received. She did want me to highlight, though, that she would get the vaccination again, and that she is very supportive of vaccine efforts, but that unfortunately she is perhaps, again, cause and effect is difficult to prove, but she is perhaps one of the statistics we've heard about with the J&J vaccine, and very, very rare and sometimes very, very uncommon blood clots. So she will be starting the end of June. She's already purchased a home in Pocatello. She's excited about the deer and turkeys that she knows are in her yard, not as excited about the mountain lions that have been sighted just down the street from her place here in Pocatello. So she's excited to get here though, and obviously it's unfortunate that she's had this medical setback. She's doing well, and I'm in contact with her regularly about her plans and being able to get fully moved out here to Pocatello. The program health process continues to move forward. I think most people were aware that program plans, if they weren't part of the budget, the program remediation plans were due May 1st. Those are going to continue to be evaluated, and we'll be hearing more about what's going to happen with program health. That is a required process by the State Board of Education. That's that all the universities go through a program health and evaluation process. ISU is also preparing for the Northwest Commission on Accrediting Colleges and Universities. NWCCU is our accrediting body. Our 7-year accreditation visit is in October of this year. So the Office of Academic Affairs, Joanne Tokel, Darren Blackburn, interim provost Karen Appleby, Cindy Hill are all working very, very hard to get the university ready for this accreditation visit. Obviously, it's been ongoing for some time. And then I just wanted to say what an outstanding job folks did with Research Day. I thought the turnout was fantastic. I thought the keynote speakers, Nancy Devine and our two outside speakers that talked about innovations and technology in healthcare were just really, really outstanding. And under difficult circumstances, once again, folks came through with a really fantastic Research Day. And I sat through some of the student and grad student and faculty presentations, and really interesting topics, and a good job done by all. We also wanted to just acknowledge our professional achievement recipients, Casey Jackman, who's out of our radiographic science program for the College of Health. The School of Nursing selected Vicki Blair, and the College of Pharmacy selected Amber Fisher. These folks, obviously this year we didn't have the same kind of celebrations and banquets and award ceremonies. So it was a little difficult to recognize these individuals as effectively as we've done it in the past, but some really outstanding professional achievement recipients this year. And thanks to all of you that participated in that process, provided nominations, etc. Our, oops, I skipped one. Outstanding student recipients for the College of Health was Addison Biasan, John Roberts for the College of Pharmacy, Katie Chapman for School of Rehabilitation and Communication Sciences, and Catherine Estep from the School of Nursing. Again, some really outstanding students, and it was great to see several of these students during the graduation ceremonies a week ago Saturday. Two of our faculty were also distinguished this year, and Marjorie Montanus from our medical lab science program was nominated as an outstanding teacher and ultimately won the 2021 Distinguished Teacher winner. I think people remember that there are a slate of outstanding teachers, researchers, and service award folks put forth, and then one of those individuals is selected as the distinguished teacher, researcher, or service provider. And we're super excited that Professor Montanus was named the 2021 Distinguished Teacher for ISU. Mary Neese was also nominated. Congratulations to Dr. Neese for Outstanding Researcher. Sarah Godsey from Geoscience was ultimately selected as the Distinguished Researcher, but certainly Dr. Neese's work and contributions in the area of health services research in the School of Nursing were very much recognized by the committee and by her peers. So congratulations to Professor Montanus and Dr. Neese. I wanted to acknowledge a couple of retirements that I'm aware of, and I'm not aware of all of them, and maybe all of them aren't public even yet. But Paul Cady, who is a longtime colleague of mine, I've worked with Paul in many different capacities over my 28 years and his probably close to 32 or 35 years here at the university. Professor Cady, we're gonna miss you at the institution, and certainly you have made tremendous contributions.
Rex, I think you're frozen.
I'm frozen.
You were frozen for a moment there.
Okay.
In the middle
Can you guys
of
hear me
talking
now?
about Paul Cady. Yes.
Okay. Well, I'm sorry about that. Are you guys hearing me okay now, Leanne? Okay.
Yes.
Sorry about that. I was just saying that it's been a pleasure working with Paul Cady, and we'll miss him and wish him the best in his retirement. Dr. Ron Solbrig also actually retired late last year, and it was a retirement in fits and spurts because of COVID, and Ron was helping us tremendously and continues to help the COVID Health Committee with medical oversight and decision-making related to keeping campus safe. And so even though he officially retired as the director of university health, he's still been very much involved in keeping the university healthy. Leanne, are you hearing me okay still, or am I still locking up?
I can hear you just fine now.
Okay. I'm going to move on. We also have several folks leaving the institution, and we acknowledge their tremendous service and wish them all the best as they move on to other positions. Folks leaving include Tamara Ains, Rachel Boot, Nishan Borden, Tina Case, Lonnie Chacon, Jesse Call Fight, Angela Jaglowitz, Melanie Jones, Logan Lamprecht, Nancy Moore, April Orduno, and Trevor Ward. Several folks that have been with the institution for quite some time and been involved with our growth and development of a variety of different programs, from the College of Pharmacy to the School of Nursing to the College of Health, Radiographic Science, et cetera. And so thanks to all of you for your service to ISU as well. So before I end, I think many of you are aware there was an employee engagement survey that was distributed by HR. There were several hundred responses from the Division of Health Sciences, and so HR provided those results to us. We're going to post those. If they're not already posted, they will be shortly on the DHS website. There's about 40 pages of tables and graphs that you can look at. And look at the different questions. There were dozens of questions asked that related to the workplace environment and how the university was doing with its COVID response. There are some highlights and a few lowlights, I guess, as well. And I'll just provide a few of those, but you're welcome to take a look at the employee engagement survey for the division. Clearly, communication continues to be an issue. We at the divisional office are always open to input. I've been happy to do these town halls and talk with folks about what's going on in the division. And we are always looking at ways to improve getting the message out. But I think it's at all levels of the organization. So from the division level to the colleges and schools and down to the departments and programs, and even out to the faculty and staff at a very local level, that information still tends to be either slow to be disseminated or not all the message gets out. So being apprised of changes and new developments have specifically been noted in that survey of, of deficiencies, folks that think that we could do better with that, and we will continue to do that. I will say that that a lot of information is distributed in that twice weekly ISU Today newsletter. And if you're not opening that email and looking in there, you're likely to miss things, including the open comment period on policies, for example, that are put forth in terms of policy changes, new policy development. So I would really encourage folks to look at ISU Today when it comes out each week. The other area that was a bit of a deficiency in the survey was that feedback this past year was not felt to be as forthcoming. I think that probably is related to the fact that we haven't been together. But for those folks that are in manager level roles, chair level, program director, supervisory roles, people have felt that feedback has been a bit deficient this past year. And that's a change from the survey that was done in 2018. Confidence in leadership is generally positive, but I will note that there is some spread in the data. Leadership is lumped together as deans, chairs, program directors, vice presidents, associate vice presidents. So I'm not sure if that was directed at me or at your department chair or at your dean or associate dean. But for the most part, confidence in leadership has been generally positive. And then in terms of positives, and I put these in green, people felt encouraged about their job and about the role and responsibilities that we have at ISU. They felt like it was a safe, cared for environment. Most people felt that issues related to equity and inclusion and diversity were well handled by the university, although there is some spread in the data. People felt that our mission at ISU is very fulfilling and that the people around them are also committed to quality work. And the university's handling of COVID-19 generally received high marks as well. Again, there's spread in all these data points. This was a 7-point Likert scale for these, from strongly agree to strongly disagree, and 5 data points in between those. But for the most part, these were some areas that I pulled out that were highlights and things that we could work on a little better. And I encourage you to take a look at that survey if you're interested. So I'll pause there. We've got 15 or 20 minutes to answer questions, or we can always end early if we run out of question and answer time. So Leanne, you want to circle back to budget and CEC related questions?
Yeah, I can do that. One of the questions was, will those who are funded through grants be eligible for the 4% raise or 2.5% as we were talking about?
My understanding is that the application of the raises will be across the funding sources. So if the HR plan is for a 2% average increase or 2.5% average increase, that will be applied to all funding sources, including grants. That folks on grants can't get more just because it's a different funding source.
And there's just one other comment related to budget. It would be nice to average both last year and this year, since some people likely had higher performance rating last year without a raise to match that year.
I think that's a really good point. And we can provide that feedback to HR, right? Because you're right, some people have had significant increases or potentially even a decrease in their merit rating from one year to the next.
And then there was one other question submitted in advance related to budget. With proposed state budget cuts and COVID setbacks, why doesn't ISU begin offering early retirement options? It's much less painful than mandatory furloughs.
Yeah, that's been discussed before, and typically the State Department of Human Resources has not been supportive of, sort of contract buyouts or early retirements. I I don't disagree. It's just not an approach that the state has been supportive of up until now.
Okay.
I see Ryan Giraffe's hand is up. Ryan, did you have a question?
Yeah, I just have a quick kind of follow-up question, Rex, for you on that grant question. So I guess maybe thinking optimistically, if we are able to increase enrollment, so again, this probably won't apply to this year, but going forward, if we're able to do well, increase enrollment and increase some of those sort of outside funding sources such as grants and donations, in the past, if we're able to do that, is the university then able, because essentially we don't have the university funding this year to provide the full CEC. If the university
Correct.
didn't have a deficit and we're in the positives, in the future, will the university be able to essentially incentivize us, right, for hitting some of those goals by providing a larger than state recommended CEC with the university essentially supplement?
Yeah, it's always an issue, Ryan, because we'll take the division as an example. About 42% of the division is funded off what we would call local funds. Those are not appropriated dollars, and so if we don't increase grant revenue, if we don't increase clinic revenue, if we don't increase professional fee revenue, those funding sources don't go up each year. And so an increase of say 4% ends up being a cut, right? If we don't increase a like amount for the individuals that are funded off those sources. So we are almost always at a disadvantage at the university because, unlike, say, the State Department of Transportation, where all their money comes from the state as appropriated dollars, they get a 4% increase, let's say, this year, right? And that's just an across the board thing that they then distribute based upon merit. We at the university have a significant chunk of folks that just are not paid on appropriated dollars, and the state doesn't fill that gap, okay? That funding deficit has to be filled in other ways. Now, if we grew enrollment, if we increase these other funding sources, could the university then act like the State Department of Transportation in my example, right, with a full 4% increase? The answer is yes, it could, but it's not likely to happen if we're still running a budget deficit at the university. Other questions, Leanne? Oh, you know what? There was another one that somebody asked related to the Professional Achievement Awards and moving those to the fall, maybe to homecoming. I think that's a fantastic idea, and I'm going to make that suggestion. I'll carry that forward. The concern was that the Professional Achievement Awards kind of get, I don't know, we're giving a lot of awards in the spring, right? Student awards, faculty awards, and the Professional Achievement Awards. It might make sense for those alumni to be honored at homecoming rather than at graduation, and with all the student awards and faculty awards kind of diluting out, I guess, the recognition that occurs at that time. So I think that's definitely worthy of further discussion, and I appreciate the suggestion that came in.
Related to that note, I just wanted to add, Michael Sturmack was selected as the Graduate School's Professional Achievement Award, and he is alumni of SRCS. So it's kind of a combo award. If anyone was wondering why there wasn't a recipient from SRCS, there was.
Thanks.
So,
I'm sorry we missed that one on the slides.
There's a couple other questions somewhat related to budget. And I'll just start with one. There's a couple, I'm trying to decide which one is to start with. What is your sense of how the SBOE will support the long-established principles of academic freedom and support faculty against the recent repressive actions of the state legislature and governor regarding HB 377, which is now law?
So I think that's a really good question. The state board reaffirmed support for higher ed. They also reaffirmed their position that the indoctrination allegations that have been made against higher ed based upon teaching critical race theory or social justice or diversity, equity, and inclusive initiatives, that really there isn't. This is a solution in search of a problem, is in essence what the state board said, and I agree. There are one-off cases, there are anecdotes, there are stories that have yet to be validated, that the legislature and individuals within the legislature have trumpeted as examples to the horrible things that higher ed is doing to our student body. The state board has been quite strong in coming out with those statements, and the new state board president, Kurt Liebig, is very much a supporter of higher ed and was quite critical of these discussions and allegations that were coming against higher ed. We, at our state board meeting a couple of weeks ago, there was a long discussion about this. You can find it on YouTube, and it's the latter maybe 30 to 40 minutes of that meeting. And I think it would do a lot to reassure folks in higher ed that at least the State Board of Education has our back to some extent. It's unfortunate that we're part of the executive branch, and the governor signed that into law, recognizing that that was politics, and that the House and likely the Senate would not have approved budgets for higher ed moving forward at the level that we're currently sitting at in the proposal if the governor did not sign 377. So that's the I guess trade-offs of politics. The governor didn't have anything nice to say about that, but did in fact sign it. I think with the political concession that our budgets be able to move forward, his budget or something close to his budget for higher ed and K through 12 be able to move forward, because both those were being held hostage, if you will, through this political process. So the other thing that I would say is there was a joint press conference between the governor and representatives from the state board. The incoming and outgoing president of the board both spoke, and I would encourage you to watch that as well. That was also would have been 2 Thursdays ago and is archived on either the governor or the state board YouTube video archive. So I personally think that the state board is supportive. The question is, will they be able to convince some of these elements of the legislature, particularly in the House, that that this really is a solution in search of a real problem in higher ed in Idaho.
And related to that, beyond valuing faculty's academic freedom, many health professions accrediting bodies require the teaching of social justice related issues and advocating for equitable access to healthcare and services. How will the SBOE or President Satterlee support such programs?
So we had a meeting with the SBOE and the incoming and outgoing president of the board. And I was able to mention that exact point. I pointed out some of the important social determinants of health, utilizing, access to healthcare, racial and ethnic minorities, and the impacts of certain illnesses on those groups. I also pointed out that this is an important element in virtually every accreditation that we have in the health professions and across the university. There are other specialized accreditations that the university holds in various programs, and that these points need to be covered, and people need to understand these issues to be able to do their jobs in the right way, particularly as a healthcare provider. So the state board heard that. They were supportive of that. We provided a tremendous amount of information. I think many of you may be aware, but some of you are not, that we asked all of our departments a few weeks ago, even before this issue really hit the press, to provide us with the kinds of information that supports our argument that we need to be able to be teaching this, whether it's an accreditation issue, a licensing issue, a board issue, or whether it's one of our professional oaths, right? Many of our professional oaths that we take reaffirm our commitment to these kinds of concepts. And so we have shared all of that with the board office. We've shared it directly, face to face, at least via Zoom, to the board presidents and representatives of the board. We explained to them that very, very quickly, if we lost our accreditation, we would be turning out 0 nurses, 0 pharmacists, 0 PAs, physical therapists, whatever the discipline that we're talking about here, if we lost our accreditation because we weren't able to teach these concepts. And so that information is in, I think, the right hands to be able to share with interested parties. And I think we should continue to have those discussions, because it's really important that we talk about these things, and it's really important that we support them, and that we're making sure that our healthcare providers are well-versed in these issues to be able to provide well-rounded and equitable healthcare, just healthcare, to anybody that seeks out our care and services.
Okay,
I
there's a
see
couple.
another. Oh, I was just going to say, Leanne, there's one in the chat about some bad cement and asphalt.
Yeah.
We certainly can carry that forward and talk to facilities about that. Many of these projects have taken a very, very long time to get done. So we can note that. Connie, if you wouldn't mind making a note of that, and I can have a conversation with Cheryl Hansen. I know right outside the divisional offices in Gravely, we had all kinds of dangerous and broken concrete that they finally got around to fixing. Last summer. It was all painted yellow. It was our joke internally at the division office that it was deferred maintenance yellow was the name of that color. And maybe that's what we need to get, some deferred maintenance yellow paint to put on the cracks and the broken concrete and asphalt up by the nursing building too.
There are a couple of questions related to the search updates that you provided. One of them is, will the Meridian Executive Director position be a staff position or a faculty position?
Well, these administrative appointments are in some ways more like staff appointments than non-classified staff appointments. If the person comes in with an academic background, I think it's absolutely negotiable that they could have a faculty appointment as well. That could be negotiated.
And do you know when we might be able to start scheduling fall meetings and events on Dean Connor's calendar?
Well, so I think we could begin doing that in July. Obviously, there's just some onboarding and other things that needs to occur in the first week or so, but I think that we could begin calendaring that. We need to come up with a mechanism to do that. She is going to be initiating a search for an administrative assistant. And so once we get that person in place, it'll be much easier to start getting some stuff on her calendar. But we can talk in the division office about what we need to do in the interim to get some appointments on her calendar, even though it's almost 2 months before she gets here. But I think she'd welcome that. She obviously wants to hear about our budgeting process. I've been keeping her updated on that and other important initiatives that she can be involved with. So we need to put a little bit of infrastructure in that office, but we will soon be able to do that. And if people have, really important and burning issues to discuss, we'll come up with a mechanism to be able to make those appointments. I don't know that we have a Google Cal for her yet. She doesn't have an ISU email yet.
And will her office be there where the other College of Health dean was in the School of
Yes.
Nursing? Great.
Yes.
The rest of the questions are COVID related. Some specific questions about health exception forms, if we're ready to move into those.
Yeah, that's fine.
Okay. Are health exception forms continuing to be required for summer clinical activities?
So if we are basically operating under the same rules of engagement as this semester through June 27th. So if a course required a health exception during spring or fall, and it's going to be continued, or similar activities are going to be continued in the summer, we are asking for health exceptions. Even if it starts in the first half of summer and continues into the second half, we're treating the summer basically like spring. And the short answer is yes. In the fall, and even if a course for whatever reason starts after July 1, we're hoping and treating the approval process like we will not need to do health exceptions in the fall. We had to sort of draw a line in the sand, and that's what President Satterley asked us to do. And so it's changing right about July 1.
So you kind of touched on some of the plans for fall earlier, and I know that things may change between now and then, but there was another question about precautions that will be in place for fall semester related to COVID.
Yes, so we don't know for sure. And we're obviously going to follow CDC and state guidance, in terms of the recommendations, particularly for face coverings. Obviously, if we can work on getting our campus community fully vaccinated or as close to fully as we possibly can, the need for face coverings goes down substantially, right? CDC's already got some guidance about fully vaccinated individuals being able to gather together. So I think that is a big key here. Obviously, we're not going to be wearing a green V for those who are vaccinated and a red V for those who are not on campus, and we're not going to be asking those questions. But if people have those conversations informally, it's going to change the work environment. I will note that we can talk about vaccine status. We can't question individuals who choose to be vaccinated or not to be vaccinated. So there's a fine line between having me asking Brian Hickenlooper if we're going to ride together in the car, whether he's vaccinated and he's comfortable taking our masks off together, versus me saying to Brian, why the hell aren't you vaccinated, right? I can't do that. I can't make a judgment. I can't make people feel disadvantaged in any way. And sorry, Brian, I just see you on my screen, so I'm using you as my example. So we can have the discussion, but the discussion should not be a long one. It should not be drawn out, and there shouldn't be any criticism, either pro or con, to people making that decision. But we can begin to have those conversations about, how safe is it for Brian and me to work together in an office on a project and not have our face coverings on. That being said, when we're in large gatherings, when we're having a lot of interaction with folks where it's an unknown vaccine status, that creates some difficulty. And the CDC has some guidance around that. And that guidance still suggests that face coverings should be worn if we're in large gatherings around people where vaccine status isn't known, where distancing isn't possible, et cetera. That may change over the course of the summer, and our recommendations to the campus community will change as we get more guidance.
Rex, related to that, is there any sort of deadline to make those precaution decisions other than the July or the June 28th end of fiscal year? There's just a note, if at present no faculty are preparing health exception forms, and then when they come back on contract and on campus, what if they have to jam all of those through?
Yeah, well, we're certainly hoping, praying, however you want to get to the outcome of being back to normal. We're being optimistic about that potential. And you're right, if we have to pivot rapidly to distance classrooms or health exceptions and that kind of thing, it's going to be difficult in the fall. There at this point, we're in ongoing discussions about how to make those decisions and when to make those decisions. We are currently in the Idaho rebounds stage of stage 3 still. That limits group size and has a variety of other restrictions that are present. And as the governor changes, as we get CDC guidance that changes, as we look at the disease activity in our communities on campus, we will be making those changes and making those recommendations. But I certainly can't guarantee that if we had a decent size outbreak in a class or in a lab or in our dorms on campus in the fall, that we wouldn't have to pivot in some way to be able to address that. And I think that nimbleness is something, and that flexibility is something we're probably going to have to live with until we really sort of squash this epidemic in its entirety. And that may not be possible in the short term or even in the longer term towards the fall. I know we're over our time. Are there any other sort of urgent questions, Leanne, that I could answer? I know that I have a 1 o'clock, and I'm sure lots of people have likely dropped off. I know we've lost about 20 some people already.
We had 2 other questions, and we can do a follow-up afterwards if needed.
Okay. I think that'd be great if we could respond via email, to the group about leftover questions. Let's work on doing that. You and I can work on that, Leanne, okay?
Okay.
Thanks, everybody, and thanks for another great semester under difficult circumstances. We do really appreciate everybody's efforts, and I hope that people can get a good recharge over the summer, and we'll be hopefully back to a new normal in the fall. So thanks for a great year, and let us know if there's anything we can do to help with things. Thanks, everybody.